Hi guys, and welcome to week 7 of the vlog series here at Embodied Beings. My name is Alexa, and this week I am talking to you about the topic of chronic pain and therapeutic yoga. This is a really important topic for me to talk about in this series because I have a lot of clients who come to me, whether it's one-on-one or in group class settings, who are suffering from chronic pain. Regardless of the root of that pain, if it was a specific disorder or a surgery or an accident, anything like that. The topic of pain in general is something that we can all work with using some of the same techniques. So that's what I'm going to be talking about today, of course, how yoga works to deal with chronic pain. But I also want to share with you how we actually view and define pain and explain it from the lens of yoga therapy, some of my experiences with it, and of course, like how yoga works. So techniques that we use in yoga therapy to help decrease chronic pain and also increase quality of life. So first, the question, what is pain? In yoga therapy, we talk about pain as a subjective phenomenon. So it's a perception meant to indicate danger, thereby motivating us to stop or change our present behavior. It's a survival mechanism built into the human brain, into the human body, to help keep us safe. And we all have different experiences of pain. So, of course, there's the pain that happens, like when we sprain an ankle, for instance, that might make us stop moving and evaluate what we're doing. There's the pain of a burn, like if we touch something really hot and pull our hand away. These are some of the positive functions of pain working to our benefit and for our survival instinct in the human system. But sometimes, like, pain isn't always necessary, and it's not indicating an unsafe behavior. It can be a result of a lot of suppression, emotional suppression in the body, or pent-up tension or inflammation. And in this sense, pain isn't really serving us. It's just decreasing quality of life and making it hard for us to live these full, vibrant, present lives. So the sprained ankle example, I'll go back to that for a quick minute. It's a good example of how pain is subjective, because someone might, like one person might sprain their ankle and have a certain amount of tissue damage and experience like a 9 on the 0 to 10 pain scale. Another person might experience that same sprained ankle, same tissue damage, and say that they're experiencing a 3 on the pain scale. So, like, same injury, same damage to the tissues in the body, but completely different experiences of pain. Some people like to call this their pain threshold. Another example of pain being a subjective experience and not necessarily related to what's going on in terms of damage in the bodily systems, low back pain. So this is a very common example of chronic pain that doesn't always have a specific reason that we can see, like in an MRI, for example. And there are studies that have been done that show this, like, for example, a group of people, some of whom are experiencing chronic low back pain and some of whom are not, and they all go in for MRIs to look at, like, what the discs are doing in the spine. And what some studies have found is that, like, there are some patients who have absolutely no visible damage to the discs or to the spine or the tissues around it, and yet are experiencing chronic low back pain. And then other people who have never reported low back pain, they'll go in for MRIs and it shows that they have like a bulging or even fully herniated disc in their spine. So this is really interesting, right? Like, how come some people experience pain and some people don't experience any? And what's the reasoning for this? But more importantly, how can we help those who are experiencing pain for seemingly no reason out of that pain body, that experience? Like I mentioned before, I think chronic pain, it's this scary thing because sometimes we'll go in for a surgery to fix something that should eliminate the pain or at least decrease it, or sometimes get prescription painkillers to help ease the pain. And these things are very necessary at times, but sometimes they just don't work in the long term. And when I mean work, meaning they don't completely eliminate the pain. And so this is why I've found quite a few people who come to yoga and meditation as a last resort for dealing with pain, because they've tried everything else, and there's this sense of oh gosh, what do I do now? And that's what yoga therapists are often here to help with. How can we make life better and more enjoyable and work with the very deep healing mechanisms of the body, where other modalities, for whatever reason, just haven't worked. A little bit about me and my story. I fortunately haven't experienced any serious chronic pain. I have experienced low back pain for over a decade of my life. That could be debilitating at times, definitely impact my quality of life, because I love to do yoga practices that are more rigorous sometimes, and I love to dance, especially contact improv dance. And when I'm experiencing pain, it's not as easy to be in the body. It's not nearly as enjoyable. I've had some surgeries. I had reconstructive surgery in my left knee after an ACL tear from skiing. I've had my appendix out, so I've recovered from a surgery like that, where I'm definitely experiencing pain for several days or weeks at a time, but eventually it's gone away. So I do want to say that I haven't experienced any serious chronic pain over many, many years that's seriously impacted my quality of life. That said, I have started to work in the past couple of years with just working with breaking the pattern in my brain between perceiving a sensation that I might normally respond to as painful, and breaking the pathway that leads to a judgment of that sensation. I first got some insight into this in my first 10-day Vipassana retreat that was about a year and a half ago. It's 10 days of sitting in silent meditation, just observing the breath, observing sensation, and not attaching to it. And I became aware of the conscious decision in my mind to, when I felt pain, after sitting for hours at a time, many days at a time, I sometimes had the sensation my knees were just going to rip apart because I was sitting there for so long. How could I observe the sensation in my knees but not judge it as pain? And I noticed over time, as I was working with this in a really safe environment, that I could get to the point where I could just observe it as sensation, but not fall into that really closed, all-enveloping space of, oh my God, I'm in so much pain. Just sitting with it and watching it, and eventually the pain would start to subside and dissolve. So this is one of the tools I started working with, and then of course it led more into working with emotional pain. So noticing emotions that would come up, like anger, grief, these more difficult emotions to deal with, and observing the pain that I felt like they caused in my body, physically and otherwise, and breaking that pattern of completely sinking into the pain of that uncomfortable emotion, the sensation, and judging it. So these are some of the things I started to work with. I know it might seem a bit abstract for me to talk about, and it is something that as individuals we each have to just explore on our own. It's up to us to do the work. But I've found a lot of joy in doing that work, and I've come out on the other side of some really difficult situations training myself to not be so reactive, like right away, to difficult things, whether it's a sensation or an emotion or just a difficult situation that I'm in the external world. And it's been really helpful. And then, of course, overall, like as we move more deeply into this practice of managing painful sensation, we're able to detach it from our sense of self. So this big, like, overreaching thing that says, oh, anger, this is who I am, or, oh, like, back pain that's here day in and day out, this is who I am. It's not who we are. Like, it's not something that will be there forever and ever, and it doesn't have to define us on any level. So these are some of the things that I've started to work with, just a brief overview. And it's been a big part of my healing in terms of dealing with, like I said, anything painful, whether it's a painful sensation like stubbing my toe, or a painful emotion like dealing with some really, really deep-rooted grief regarding different relationships or wounding in myself. Now for how yoga works, and I want to first make a disclaimer that like I mentioned before, pain is a survival mechanism that's built into the body to stop us or help us retreat from a dangerous activity or situation. So what I'm talking about in this video is pain that does not necessarily serve our basic survival, and how we can use observing sensation and breaking those patterns of judging it as pain as a tool for well-being, but always in these like safer environments. So one way that yoga works, it decreases chronic pain by activating the parasympathetic nervous system. So this is our rest and digest mode. It's when the body is enabled to activate the self-healing mechanisms, inflammation is reduced, the body has a chance to fully rest and do its repair work. When we're in this like agitated fight or flight mode all the time, which sometimes we can be in if we're simply in pain, the body doesn't have a chance to do more of the deep healing work, because the signals it's getting is like, no, I've got to stay alert, I've got to stay in fight or flight because something might happen, right? It's a dangerous situation. That's what's happening kind of like in the limbic brain. So we're working to just cool down this reflex so that some of the deeper healing can occur. Yoga also works with staying in the present moment. So it gently breaks this habit of running away from sensation by staying with what comes up and just observing it with objective awareness. Part of the habitual pattern that's reinforced when we like feel pain and judge it right away as pain is the brain registers it as like, oh, this is pain, it hurts, I don't like it, run away from the present moment. So when we practice yoga, we're always working like to stay in the present moment, and it just helps to train the mind that like it's okay to be in the body even when there's some discomfort. Mindfulness. This is the third big way in which yoga works, and I would say it's the biggest when it comes to shifting our experience of pain processing. Mindfulness involves noticing sensation, identifying it as sensation or maybe as a specific emotion, but not identifying with it, like thinking, this is me. So when we do that, when we observe the sensation without jumping to the judgment of it as pain, we're able to break this pattern of pain processing and eventually just like be okay with the sensation. One of the foremost studies on chronic pain management conducted quite a while ago in 1982 by this famous researcher, Jon Kabat-Zinn, maybe you've heard of him. It demonstrated the potential for improved quality of life through mindfulness, even whilst the condition itself is not cured. So in this specific study, they had 51 chronic pain patients who had not improved after treatments in traditional medical care go through 10 weeks of specific mindfulness training. And by the end of those 10 weeks, 65% of people showed a significant reduction in pain despite underlying medical conditions remaining. These underlying medical conditions supposed to be causing the pain. So that's pretty significant. Like, the condition was remaining, but the experience of pain had decreased and quality of life had gone up after 10 weeks of mindfulness training. So this shows you some of the potential that mindfulness has, mindfulness being a big part of yoga therapy in reducing chronic pain. And finally, like I mentioned before, we can choose to go into pain and use it as a tool for reducing reactivity in daily life. This is a great example of how we can use meditations like Vipassana, like mindfulness, to sit with ourselves even if we don't have chronic pain, like to sit and just watch things come up, whether it's a physical sensation or an emotion, and just observe it and practice not reacting to it and sinking completely into it, so that in our lives off the mat, our brains are programmed to not react so uncontrollably to any uncomfortable situation, whether it's in our own bodies or in our external lives. So this is my spiel on chronic pain. And please, if you have any questions, if you've suffered from something specific with chronic pain and care to ask me a question or comment on this video, please do so. And otherwise, I will see you next week for week 8. Thanks so much for watching. Have a beautiful weekend. Bye.